Hi everyone, how are you? Welcome to another videos regarding MRCS, and this is the question answer session. And the solve of the question is the best, one of the best way to prepare yourself for MRCS exam and pass the MRCS exam very easily. So here our question: a man undergoes a high anterior resection of for carcinoma of the upper rectum. Which of the following vessels will require to ligate? So here, a man undergoing high anterior resection for carcinoma of the upper part of the rectum, which vessels will require to ligate? That means which of the vessels is supply the upper part of the rectum. So we have to find out first of all rectum, then blood vessel of the rectum, and we have to find out the vessel which supplies the rectum. Here the options are superior mesenteric artery, inferior mesenteric artery, celiac axis or celiac trunk, perineal artery, and middle colic artery. So here the blood supply of the left part of the colon, sigmoid colon, and rectum. Here is the left colon or descending colon, and from here to here this is the sigmoid colon, and here the rectum, and rectum represent three parts: upper part, middle part, and lower part. So here we can see this is upper part, then this upper part is supplied by the superior rectal artery, and if we go upward we can see the superior rectal artery, it form another trunk with bindings with the artery supplying the sigmoid colon, and it goes upward, and if you see this large trunk is the abdominal aorta, and this artery it inserted in the abdominal aorta, or it originated from the abdominal aorta, and this is the inferior mesenteric artery. So inferior mesenteric artery, it gives blood supply to the left part of the colon and sigmoid colon, and also the upper part of the rectum. So due to operation of the rectal cancer, the superior rectal artery which supplies the rectum, and if we ligate the above part, we have to ligate here, and it is the inferior mesenteric artery. In this picture we can see here, here the all colon, this is terminal ileum, appendix, cecum, ascending colon, hepatic flexure here, transverse colon, it is the splenic flexure, and descending colon, sigmoid colon, and rectum, and it is the upper part of the rectum. And we can see the blood supply of the different parts of this. The superior rectal artery, it goes backward, and it arises from the inferior mesenteric artery. So here our final answer is inferior mesenteric artery. This inferior mesenteric artery, it supplies the blood to the upper part of the rectum. So during the high anterior resection of the carcinoma of the rectum, the superior rectal artery will be ligated, and from superior rectal artery above ligation. So for above ligation we have to go to the inferior mesenteric artery, and if we see the superior mesenteric artery, here we can see this is the superior mesenteric artery, and superior mesenteric artery supplies this part of the colon, here this part of the colon. So it is not supply the rectum. And the other structure, celiac plexus, it is it supplies the small intestine and stomach, and liver, gallbladder, spleen, and pancreas. Perineal artery, which lies in the perineal region, and middle colic artery, which supplies the middle part. In case of high anterior resection, the middle colic artery will not be sacrificed, and middle colic artery, it is branched from internal iliac artery. So our final answer is inferior mesenteric artery. During the high ligation or high anterior resection of the carcinoma of the upper rectum, inferior mesenteric artery will be ligated. Thank you all.